order for us to carry out these studies here at the DLR in Cologne, we have set up a wonderful team of collaborators. It's a really, truly international collaboration and very multidisciplinary. And we were trying to study devices that could measure cerebral blood flow, cerebral metabolism, intracranial pressure, but we wanted to use devices that are either already developed or devices that are in the pipeline for development, but we thought that was very promising. The key factor here is that we wanted to pick devices that were non-invasive and they were easy to use, simply because we were thinking that they could be used up in the International Space Station, and also devices are portable, very easy to manipulate, and those are the devices that we're using. Now, the other important component is that those devices, they could also be used in humans down here on Earth, particularly in the neurocritical care unit, patients that have critical conditions of the brain with brain swelling and increased intracranial pressure, so it could be very easily used. Right now, everything we have is invasive and requires some type of surgical procedure, whereas with these devices, we can do them and anybody can apply them, and they could be used anywhere in the world, so that's also another important component of our study.
This was really a gigantic, mammoth effort with international collaboration, so it was very exciting to involve multiple organizations, including the National Space Biomedical Research Institute and Baylor College of Medicine, as well as the DLR and University of Cologne, Massachusetts General Hospital, and University of Texas Houston. All had investigators, and as part of the Baylor College of Medicine, working closely with the NSBRI, we are going to have much exciting data along with our German collaborators. So we're both a team that is going to be analyzing the data over the next year, and with that data we'll be able to have further collaboration and exciting studies.
We work now here for 3 weeks with the American doctors as well, and I like this team much. It's a great pleasure to work with the doctors of the Baylor College together. They do a great job here.
At this moment, because of the body angle, most of the blood that normally when we're standing is in our legs, it's shifting more toward the head due to gravity. And so this makes it more difficult for the blood to get out of the brain. And so what happens is people usually have a feeling of head congestion. They feel like their nose becomes stuffy. And this is because of too much water and blood that's just staying inside the skull. So we think that the astronauts have a similar problem when they are up on the space station, and that it may even take several months before they can adapt. What we can tell so far is that the human body is very good at adapting to fluid shifts toward the head. And so what we've noticed so far during the study is that initially there seems to be a much larger fluid shifting toward the head, and then after about 24 hours the body starts to adapt, and the internal jugular veins, they start to return more toward the normal level. And so this indicates that there's a very good adaptation to extra shifting of fluids to the brain.
The TCD is an established device that can measure the velocity of blood flow in the brain vessels and gives us an indirect insight into brain perfusion. There are some other devices that can probably indirectly measure brain perfusion in other ways, and it's very important to compare this to the TCD. We are very curious about that, if those new devices can measure the ICP indirectly, which would be had an enormous value for patients on the ICU, and if this shows positive effects, we would use some of these new devices on our ICU, of course.